Hey everyone, this is Dr. Sanders of Arthro-L Naturopathic. So like us on Facebook, and you can join our Facebook group, Research on Natural Medicine for Autoimmune Disease. I'm a naturopathic physician. I specialize in autoimmune disease. That's what I do all day long. Just see autoimmune patients looking for the underlying cause. And so we are doing a Q&A today. So on my Facebook group, I will, from now on, be doing Q&As where you can just ask some questions and I'll answer them. So hopefully I can do it live one day, but I've got a 1-year-old at home, so it's a little hard to find the time for that right now. But here I can kind of schedule it and do it as I need to. So I have some questions from my Facebook group members. I'm going to try and answer those. And then in the comments, if you have other questions, or if you join our Facebook group, again, Research on Natural Medicine for Autoimmune Disease, I can answer them for you there too. And so the first question we have from Eddie is about what type of treatment plan would you do to help someone lower their inflammation? And so we always want to get to the root cause when it comes to an autoimmune disease. So you can have 5 different people with the same diagnosis, and we're going to treat them all completely different because for each person, we're going to think that the cause of their inflammation is different. For some people, they're inflamed because of their diet. Some people, maybe it's an infection. Other people, it could be a toxin, for example, and there are so many others. So I always try to look for the cause. I don't like to just treat the symptom, and here the symptom is inflammation. And so maybe I'll do that for the short term with anti-inflammatories, turmeric, fish oil, boswellia, CBD. And so these are anti-inflammatories. But what I'm doing in the long term is looking for the cause. And once I can find the cause of your inflammation, then I can target your treatment. So it's a little hard to answer that question without knowing the cause, but I might start with just some anti-inflammatories. The second question was from Christine from Australia. And so she wanted to know, can you have disease activity when you don't actually have flares? So she talks about how she's managing well, wants to know, is the disease still active even if overall you feel like your symptoms are controlled? And if you have pathology where there are labs to indicate disease activity. So for rheumatoid arthritis, we have the CCP. For lupus, we have complement. We have SED rate, we have CRP. So I'll use those blood tests to answer your exact question. Patient might have very little symptoms, but maybe their disease is still active, which we want to know because that would mean that there's still joint destruction. If you don't have a lot of symptoms and you're not flaring, it's a pretty good sign that the disease activity is still low. It's a good sign, but I still want to look at those blood works. CCP, complement, SED rate, ferritin, CRP. These are all signs of the disease activity. And others based on your disease. If you had myositis, I might look at CK. So it just depends on your particular disease. But I do monitor the disease activity with blood work. If you are pretty controlled with your symptoms, again, it's a pretty good sign that you don't have it. Look at some other questions. Someone asked a really good question, Sandy. Can you have immune deficiency and an autoimmune at the same time? It's rare. Most of the time, if someone has an immune deficiency and an autoimmune disease, it's because they're taking a drug for their autoimmune disease that's suppressing their immune system. And so they've become immunosuppressed because of their medication. But in some cases, you can have 2 diseases at once, an autoimmune disease and an immunodeficiency. You can imagine it's pretty unusual. Happens though, because what's happening in that case is you have one part of your immune system overactive, creating the autoimmune, and another part of your immune system that's underactive, causing immune deficiency. The best thing we can do for this case is use immune modulators. There are certain herbs and nutrients that will balance. They don't stimulate the immune system. They don't suppress the immune system. They balance the immune system. So if you're too far this way or too far this way, they bring you back to the middle. Honestly, the best thing for that are probiotics. So definitely treating the gut. I would definitely treat the gut for a situation like that. The gut is where those dysfunctional signals come from. If you don't have a strong enough immune system or a too strong immune system, it comes down to the gut. So in this case, I would really start with a comprehensive stool analysis, look for leaky gut, look for inflammation, and look for the probiotics. And then based off of those levels, I would really work on a total gut healing protocol. And probiotics are one of the best ways to balance that immune system. Nicole asks, if you have one autoimmune disease, will you automatically develop another? Automatically is the key word here. No, it's not automatic, but you definitely are at a higher risk. We know that autoimmune diseases come in families. In groups, also in families, but here they come together. So when you have one, you are a little bit more likely to have another. we can prevent that. We can work on that. So when you have one, you're more likely to have another because you're not treating the cause. You could take prednisone or some kind of drug for the one. Your body is smart. Your body will just turn it into another. The body won't just deal with being suppressed. So you can take a drug for, let's say, lupus, but you haven't actually worked on the autoimmune brew that's in your body. So your body is wise. It'll just make another one. And so we have to get to the root cause. And if we get to the root cause, we can really try our best to stop all of them from coming. Jessica asks, does Graves' disease have any specific symptoms after thyroid is removed? Great question. I think so. Even though the attack on your, and this is a great example of allopathic, just kind of suppressing the symptom, not getting to the cause. Graves is an autoimmune disease on your thyroid. So they're like, well, let's just take the thyroid out. It can't attack anything. Well, you still have these antibodies and this inflammation in the body. You haven't actually gotten to the root of why the autoimmune is there. So just like I mentioned before, the body is smart. It'll find another way to express that inflammation. So even though the thyroid has been removed, we really still need to look for why this happened and where's the root of the autoimmune coming from. So it's a great question. Okay, let's see. Working down the list here. I don't know so much about bee propolis. There was a question here. I can look a little bit more into that for you. I don't use it a whole lot. And then they asked, does aloe work for gut health? Yeah, definitely can if you have signs of inflammation. And then removing the tonsils reduce risk of infection. Only if you've tried everything else. If the tonsils are enlarged, you are more likely to get infections there. And if you have an autoimmune disease, that can flare things up. And so the theory of removing the tonsils is you take that away. Again, not getting to the root. If you keep getting infections in your throat, we need to figure out your immune system. Another question from Christine. She talks about having had a baby and worrying about the baby getting autoimmune. This is a super unique service we offer at ArthroWell Naturopathic, where we will treat family members of patients with autoimmune diseases. Even if they don't have one, we want to try to make it that they don't get one. So if we know what your triggers are, let's say it's likely that you have leaky gut or you have food sensitivities or hormone issues, stress, and we think that's triggering your autoimmune, I'm going to test your family for that. I'm going to test your family ahead of time and work on any lingering issues. I can't tell you how many times I see family members of somebody with an autoimmune disease showing the initial signs of leaky gut. It's not actually doing any symptoms yet, or maybe little symptoms like eczema, or something like that, GI symptoms, constipation. If we can work on that now, we can stop it from snowballing into something bigger. So that's a great question. Someone talked about pandas and PANS. It's a gut issue. What happens with kids with pandas, which is an autoimmune disease against the brain, they get loaded with antibiotics. Okay, it's fine to do that for a little while. I see so many kids with pandas who are on antibiotics for years. Do you know what kind of damage that does to the gut? We need to heal their gut. We need to do a stool test. We need to do food sensitivity testing, which you can order through us. Order these through me. They're super inexpensive compared to ordering them online or going through a functional MD. I'll order these for you. I'll interpret them for you. Pandas kids need a gut analysis, especially if they've ever been on an antibiotic. And then we can get to the root of the autoimmune. So that was all the questions. Not too bad. I think I did all right with those. So keep them coming. I'm happy to do these Q&As regularly. Again, ArthroWell Naturopathic is the practice. Like us on Facebook. And we do order functional testing for anybody in our group. So if you do want to reach out and order a functional test, we order stool tests, toxin tests. We are now offering a urine roundup test. So if you want to see if you've been exposed to glyphosate, which is Roundup, the Monsanto thing, you can test for it, test your urine for it. It's a trigger sometimes. We look for other toxins, food sensitivity testing, hormone testing, pretty much any functional test you want. Most likely we can order it for you. So reach out, order it, pricing info. I interpret it specifically with an autoimmune lens because that definitely changes the way these things are looked at. So you can capitalize on that expertise. You don't need an appointment. So please reach out to us if you want to order those. And we also do telemedicine consults. So if you're not close to Connecticut, contact me. We can do a Skype, Hangouts, however you want to consult, we can consult. If you have any other questions, comment below.